Today I will talk about the human papillomavirus and its clinical implications. The human papillomavirus is a common virus with more than 100 different types affecting humans. It mainly spread through skin-to-skin contact, especially sexual contact. Most people will get some type of HPV in their lifetime without even knowing it because the virus often causes no symptoms and goes away on its own. However, certain types of HPV can lead to health issues, including genital warts and various forms of cancer. The clinical implications of HPV. Genital warts caused by some types of HPV. These are small growths or tags on the genitals or surrounding areas. They can be treated but might recur over time. Certain high-risk types of HPV are responsible for the majority of cervical cancer cases. HPV is also linked to other types of cancers, including cancer of the vulva, vagina, penis, anus, and throat. The risk of developing these cancers depends on several factors, including the type of HPV and the immune system's response. In most cases, the body's immune system clears HPV naturally within a few years. However, if the virus persists, it can cause cell changes leading to cancer. The diagnosis. Confirming a diagnosis of human papillomavirus involves several methods depending on the suspected HPV-related condition or the routine screening process. Here are some of the recommended tests to confirm an HPV diagnosis. For genital warts, a healthcare provider might be able to diagnose the condition by simply examining the warts. However, if there is uncertainty, they may apply a mild acetic acid solution to the skin, which causes warts to turn white and become more visible. A Pap test is a routine screening for cervical cancer and its precursors. During the test, cells from the cervix are gently scraped away and then examined under a microscope to find any abnormalities. This test doesn't directly test for HPV but can indicate changes in the cervical cells that HPV may cause. In this slide, changes that occur in cervical metaplasia are shown. You can see an intermediate cell and compare the other abnormal metaplastic cells with abnormal features. The HPV DNA test involves testing cells collected from the cervix for the presence of high-risk HPV types that are more likely to cause cervical cancer. This test can be done on the same sample of cells collected for the Pap test. It is recommended for women over the age of 30 as part of routine screening or for younger women if their Pap test shows abnormal results. If either a Pap test or HPV test indicates abnormal results or if genital warts raise concerns for cancer, a biopsy may be performed. This involves taking a small sample of tissue from the cervix or in the case of warts from the affected area and examining it under a microscope to look for signs of cancer or other conditions caused by HPV. For individuals at high risk of anal cancer, such as men who have sex with men, HIV positive individuals, or those who have had genital warts, an anal Pap test or anal HPV test may be done. These tests are similar to cervical testing but involve taking a sample of cells from the anus. For cancers of the throat, penis, vulva, or vagina suspected to be linked to HPV, a biopsy of the affected tissue is typically necessary to confirm a diagnosis. The tissue is examined for cancerous changes and may also be tested for HPV DNA to determine the presence of the virus. Treatment for human papillomavirus focuses on managing symptoms and complications, as there is no cure for the virus itself. The body often clears HPV on its own without causing any health issues. However, when HPV does lead to issues like genital warts or precancerous changes in the cervix, there are several treatment options available. Treatment for genital warts. Topical treatments. Medications applied directly to the warts, like some topical cream, can help clear them. These treatments stimulate the immune system to fight the virus. Physical removal methods such as cryotherapy that involves freezing the warts with liquid nitrogen, electrocautery or burning of the warts with electric current, surgical excision or cutting out the warts, and laser therapy are used to remove warts when topical treatments are not effective. Management of precancerous changes. For women, regular Pap smears and HPV tests can detect changes in the cervix caused by HPV. Depending on the severity of these changes, treatment might not be needed immediately. close monitoring of procedures like a colposcopy, which is a closer examination of the cervix, cervical biopsy, or treatment methods to remove or destroy the abnormal tissue, such as cryotherapy, LEEP, that is loop electrosurgical excision procedure, or cone biopsy may be recommended. Precancerous changes caused by HPV in areas other than the cervix, like the anus, penis, vulva, or throat, also require monitoring and can be treated with similar removal or destruction methods if necessary. Cancer treatment. If HPV leads to cancer, treatment options depend on the type and stage of cancer and may include surgery, radiation therapy, chemotherapy, or a combination of these treatments. The most effective way to prevent HPV-related health problems is vaccination. The HPV vaccine is recommended for preteens, but it is also beneficial for unvaccinated people up to age 26 and in some cases up to age 45. Regular cervical cancer screenings, Pap tests, and HPV tests for women are crucial in detecting and managing changes before they turn into cancer. Although HPV is common and can lead to serious health issues, prevention through vaccination, safe sexual practices, and regular screenings can significantly reduce the risk of developing HPV-related diseases. It is also comforting to know that the body is often capable of fighting off the virus on its own. Thank you for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.